President Trump is accusing several governors of exaggerating their needs for critical medical supplies. He says that they're asking for equipment he doesn't think they will need. One of those governors is Michigan Democrat Gretchen Whitmer, who has requested a federal emergency declaration.
Your governor of Michigan, I mean, she's not stepping up. I don't know if she knows what's going on, but all she does is sit there and blame the federal government. She doesn't get it done, and we send her a lot. Now she wants a declaration of emergency, and, we'll have to make a decision on that.
Now, the governor shot back on Twitter saying that I've asked repeatedly and respectfully for help. We need it. No more political attacks, just PPE, ventilators, N95 masks, test kits. You said you stand with Michigan, prove it. And she's getting some backup from local physicians.
President Trump, for you to blame anybody but yourself is expected, it's predictable, but it's just sad. We're out here on the front lines trying to take care of our patients, working hard with our governors in the states, and all you can worry about is when you're going to get people back to work and back to church and trying to make yourself look good in all this instead of taking the leadership role that you've needed to take for so long.
Michigan has nearly 3,000 cases, the fifth most in the country. So far, 60 people have died there. Dr. Rob Davidson is the Michigan ER doctor who responded to the president's attack. He's joining us now. He's also the executive director of the Committee to Protect Medicare. Doctor, welcome, and tell us what made you decide to post a video.
Well, I tell you, so I got a few hours sleep before my night shift last night, and when I got up, my phone had a few texts from friends and colleagues kind of highlighting what President Trump had said while on Fox News last night and Governor Whitmer's response. And, in this whole crisis, as we are treating patients and waiting for surges in various parts of our state and our country, you look for someone potentially to blame, and certainly the virus is not our president's fault. But, like I said, he has needed to lead on this for so long, and his rhetoric early on that it was a hoax, that it was just like the flu or a cold, or it would be gone just like that. And now for him to be attacking governors in states that are being absolutely swamped and that are doing everything they can for the people in their state is just, like I said, it's just sad. I wish that he would step up. My committee of doctors, the Committee to Protect Medicare across this country, we've called for a national shelter in place for for him to fully enact the Defense Production Act so we can get the equipment we need. And, so far we have not seen that from the federal government.
The Ford hospital system there in Michigan is acknowledging that it drafted this memo that came out, which outlines end-of-life protocols at the facilities there. It's not in effect, we should mention, but clearly the hospital is getting prepared to make some serious life and death decisions. Are we headed to the point where there's going to be a rationing of medical equipment and treatment?
I think the big answer is we don't know, but we've seen it happen in Italy. And we know that, Beaumont system in Detroit area as well is nearing capacity of their ventilators. And so if we don't have adequate number of supplies, that will absolutely be happening. And I appreciate that hospital systems are having these conversations and are giving some direction to the doctors who have to make the decisions, because just contemplating that is a gut-wrenching idea for those of us who have been, have sworn to try to help people and save lives, that we might have to tell a struggling patient and a grief-stricken family that for lack of resource here in this country, the richest country on earth, that we just can't save their loved one. It's abominable. And in that the president could at least try to do something about this with the Defense Production Act, I think it's just criminal that it isn't happening yet.
I'm sure you've had that tough discussion before where you have to give someone bad news, but I wonder if you've ever had to give someone bad news and say that it was because you knew there was something that could save their life perhaps, but you couldn't try it. You didn't have the resources.
Only once in my life, and that's when I went and volunteered in Haiti after the earthquake. So it's really distressing. I was there for a couple of weeks, and it felt like a couple of years with those kinds of conversations happening on a regular basis in my somewhat limited French that I could speak down there. To think that this could be happening, where I live, where I've, in 2020 in the United States of America, If there's anything that can be done at the federal level, which we believe there is with the Defense Production Act and really putting pressure on industry to get us this equipment, I think every stone needs to be turned over. This is what the president really owes to us and to everyone in this country right now.
Dr. Davidson, thank you so much for talking with us.